lesions in the posterior part of the brain, most likely diagnosed primary CNS lymphoma. Hint is immunocompromised with 3 distinct hyperdense lesions in the corpus callosum sanctum vein or here in posterior fossa, diagnosed as primary CNS lymphoma. Question 46. This is also CNS lymphoma, oligodendroglioma, the medulloblastoma, ependymoma. But the important is CNS lymphoma. Again, arachnoid cyst, epidermoid cyst. CT shows incidental finding of low density lesion in the right cerebellopontine angle, low density lesion in the right cerebellopontine angle. This is not cerebellopontine angle, this is still in figure, but it will be somewhere over here in the cerebellopontine angle, right side. MI low on T1 and bright on T2. DWI signal similar to CSF, most likely diagnosed arachnoid cyst. DWI similar to CSF, diagnosed arachnoid cyst. DWI high on CSF, high signal, diagnosed epidermoid cyst. DWI high, epidermoid cyst. Question number 47. CT scan shows pentangulated rounded axial mass in the interpendicular system. With peripheral calcification, low density homogeneous foci were also seen within the parietal cistern. MRI bright on T1 and T2 with low signal rim, and MRI is bright on T1 T2 is most likely lipoma. On post-ground density images, it was of homogeneous high signal, most likely diagnosed is lipoma, low signal rim. Look here, see again, arachnoid cyst and cellular region, arachnoid cyst. Cellular arachnoid cyst, and this is epidermoid cyst and cellular region, supracellular region. And this is meningioma and supracellular region. Right? Okay, what we are discussing now, lipoma. Lipoma. This look high on T1 and T2 with no signal rim, and the axial mass in the interpendicular system, peripheral calcification, low density high signal on T1, T2, diagnosed lipoma. High on T1, fat. My best friend is pretty cool, so my melanin, blood, and fat. So high on T1. Another thing is that the fat lipoma also show peripheral calcification. Next question 48. A 12-year-old male with visual complaints, a microsupercellular lesion which is high on T1 and T2. Multiple areas of low signal also seen within it, and the dorsal cellular was partly eroded. Most likely diagnosed craniopharyngioma. We can now share craniopharyngioma. This is colloid cyst, and this is pituitary adenoma. With craniopharyngioma, it's a lesion seen in the supracellular region, and it is high on T1 and T2 and shows internal calcification. Diagnosis, craniopharyngioma. This is again called colloid cyst. Okay, so let's go to, there's no, okay, this is hypothalamic hamartoma. This is hypothalamic hamartoma. Question number 49. A 6-year-old boy was investigated for precognitive puberty. On sagittal T1 weighted MRI, there was homogeneous 1 cm well defined. Okay, there was homogeneous 1 cm well defined software mass between the pituitary stalk and mammary bodies. It goes between the pituitary stalk and mammary bodies. The mass did not enhance with contrast, most likely diagnosis, hypothalamic hamartoma. And here hypothalamic hamartoma. Child had homogeneous 1 cm mass between the pituitary stalk and the mammary bodies. Diagnosed hypothalamic hamartoma. Question 50. A CT scan showed well-defined smooth walled homogeneous hyperdense in the pineal region. That shows well-defined smooth homogeneous hyperdense in the pineal region. At which other site does this most often occur? At supracellular cistern. Can also occur at supracellular cistern. Let's see this. A large enhancing mass centered on a pineal region. This heterogeneous with aerial cystic chain, the marked compression of the tectum with resulting obstructive hydrocephalus. A little surrounding edema is also present, diagnosed Germinal. It may also be present in the supracellular cistern. Question number 51. Woman is 3 months postpartum. MRI has generalized thickening of the dura, which enhanced uniformity and small bilateral subdural collection, most likely diagnosis, and recurrent hypertension. Because patient is 3 months postpartum, postpartum hypertension occurs, postpartum Sheehan syndrome may occur. MRI shows thickening of the dura with enhanced uniformity and small bilateral subdural collection, most likely diagnosis, intracranial hypertension, no muscle. Question number 52. MRI shows well-defined mass which was homogeneously high signal on both T1 and T2 MRI signal. Okay, this is rocketic cleft shift. This is epidermoid. These two are the high signal intensity due to these are dermoid. These are fat signals. Ruptured dermoid. And this is the epidermoid in the CP angle. Epidermoid in the cerebellopontine angle. This confirmed. MRI shows well-defined mass which was homogeneous high signal on both T1 and T2. Weighted in a midline supracellular region, deviating the pituitary posteriorly. CT scan shows well-defined homogeneous low-defined mass within the supracellular region with no enhancement. Diagnosis: rocketed cleft cyst. Question 53. Okay. For familial movement disorder, CT scan shows caudate atrophy with compensatory enlargement of the frontal wall of the lateral ventricle. How is this condition inherited or autosomal dominant? This is Huntington's disease. When is there is caudate atrophy? When it is caudate atrophy, it is Huntington's disease and it is autosomal dominant. It is also a movement disorder. Question number 54. 15-year-old girl with neurocutaneous disorder and an MRI which showed vermin and hemispheric atrophy. So vermis of the cerebellum and hemisphere of the cerebellum atrophy, enlargement of the fourth ventricle. Okay, enlargement of the fourth ventricle. There are also multiple small cortical red infarcts. What cutaneous abnormality is most likely to have? Telangiectasia, ataxia. Telangiectasia. There is vermian and interhemispheric atrophy. The compensatory enlargement of the fourth ventricle. The fourth ventricle compensatory enlargement. This is fourth ventricle, this is third ventricle. Now, what other cutaneous anomalies can she have? Telangiectasia. The diagnosis: ataxia telangiectasia. Question number 55. Unusual behavior. Dystonia and dysarthria while traveling around Europe. On MRI, high signal in the caudate and putamen. High signal in the caudate nucleus and putamen. Caudate nucleus, putamen. Most likely diagnosed Wilson disease. High signal in the caudate nucleus and putamen. Most likely diagnosed Wilson disease. On MRI, images seen T2 flare hypertension in medulla oblongata, forms both the lemma and putamen and caudate nuclei. Additionally, cavern septum pellucidum and cavern vergae. Okay, but there is high signal in caudate nucleus and putamen. Diagnosis: Wilson disease. Question number 56. CT scan. Fat density was seen in the most superior part of the frontal horn of the lateral ventricle. Most likely reason: upper dermatitis. CT scan shows fat density in the most superior part of the frontal horn of the lateral ventricle. Most likely diagnosis: upper dermatitis. Question number 57. Demyelinating disease. What is the best sequence to demonstrate plaques in the posterior fossa? Axial T2. And flare for dots and fingers. Okay. Best sequence to demonstrate plaques in the posterior fossa, axial T2. Remember that these are multiple sclerosis and these are multiple sclerosis plaques. So this is seen on T2 sequence, axial T2. Okay. But what is the best sequence to demonstrate plaques in the posterior fossa, axial T2? Best sequence to demonstrate plaques in the posterior fossa, axial T2. And flare is done for dots and fingers and multiple sclerosis. Next question number 58. 5-year-old boy has multiple well-defined loosened areas with no sclerotic margin and a narrow zone of transition on his skull, axial skull. These can show enhancing soft tissue mass within the abnormal area of the skull wall, most likely diagnosed with peripheral granuloma. Okay, remember that image we remember of is a peripheral granuloma in which